Let me ask you something. Do you wake up every single morning with your mouth completely dry? Your lips cracked, your tongue sticking to the roof of your mouth, desperately reaching for that glass of water on your nightstand before you even open your eyes? Most people brush this off. They think, oh, I probably just slept with my mouth open. Or, I forgot to drink enough water yesterday. And then they pour their morning coffee and forget about it entirely. But I need you to stop doing that. Because I'm Dr. Naomi Chapelton, and in my years of clinical practice, I have seen this one symptom, waking up with a dry mouth, be the very first warning sign of something far more serious going on inside the body. Something that, if caught early, is completely manageable. But if ignored, it can quietly cause damage that takes years to reverse. So stay with me, because what I'm about to share with you could genuinely change your health trajectory. First, let's understand what we're actually talking about. Morning dry mouth, medically known as xerostomia, is the sensation of insufficient saliva in your mouth when you wake up. And I want to be very clear about something. Saliva is not just spit. Saliva is one of the most underrated protective fluids in the entire human body. Saliva contains antimicrobial proteins, digestive enzymes, and minerals that constantly remineralize your teeth. It regulates the pH in your mouth, neutralizes acids, helps you swallow safely, and even contains growth factors that support tissue healing. When your saliva production drops significantly, especially at night, your entire oral environment becomes hostile. Now here's where it gets important. During sleep, saliva production naturally decreases. That's normal. But when you wake up and your mouth feels like sandpaper, bone dry, lips sticking together, a chalky film coating everything, that level of dryness goes beyond normal nocturnal reduction. Your body is signaling a problem. The question is, what problem? Let me walk you through the key culprits, because not all dry mouth is the same, and the cause determines everything. Cause number 1, uncontrolled or undiagnosed blood sugar issues. This is the one I see most often in my clinic, and it is the one I most urgently want you to hear about. When blood glucose levels are elevated, whether from prediabetes, type 2 diabetes, or even just chronic blood sugar dysregulation, your kidneys are forced to work overtime to filter out that excess glucose. They pull enormous amounts of fluid from the body to do so. This process leads to increased urination, which then leads to dehydration. And that dehydration is most pronounced at night when you are not drinking anything for 6 to 8 hours. The result? You wake up with a profoundly dry mouth and dry, cracked lips. What makes this particularly dangerous is that many people with prediabetes and early type 2 diabetes have absolutely no idea they have it. The dry mouth might be the only symptom they notice for months or even years before a diagnosis is made. And all that time, elevated blood sugar is silently damaging blood vessels, nerves, kidneys, and the eyes. If you wake up dry every morning and you also notice increased thirst throughout the day, needing to urinate frequently, especially at night, unusual fatigue, blurred vision, or slow healing cuts, please go get your fasting blood glucose checked. Do not wait. This is the second most common cause I encounter, and it affects tens of millions of people who simply have never been told that their medication does this. Over 400 commonly prescribed medications list dry mouth as a side effect. These include antihistamines, antidepressants, particularly SSRIs and tricyclics, blood pressure medications like diuretics and beta blockers, anti-anxiety medications, bladder control drugs, and certain heartburn medications. When these medications suppress the nervous system signals that trigger saliva glands, your salivary output drops. At night, when there's nothing stimulating saliva production, no eating, no talking, no drinking, the dryness compounds. If you are on any long-term medication and you experience chronic dry mouth, I want you to bring this up with your prescribing doctor. There may be alternative medications available, or there are clinical solutions that can significantly help. Obstructive sleep apnea is severely underdiagnosed, particularly in women, because our symptoms often present differently than the textbook male pattern. When the airway partially collapses during sleep, the body compensates by opening the mouth to breathe. Hours of breathing through your mouth with no saliva replenishment leads to profound morning dryness, and it's accompanied by a very specific kind of dry mouth. It often involves a sore or scratchy throat in the morning, a feeling of exhaustion despite a full night's sleep, and sometimes a headache upon waking. Untreated sleep apnea is not a minor inconvenience. It is linked to significantly elevated risks of high blood pressure, heart disease, stroke, type 2 diabetes, and cognitive decline. If this resonates with you, especially if you snore, wake up tired, or have been told you stop breathing in your sleep, please pursue a sleep study. Sjogren's syndrome is a chronic autoimmune condition where the immune system mistakenly attacks moisture-producing glands, including the salivary glands and tear ducts. It affects an estimated 4 million Americans, and the vast majority of those are women. And it is chronically underdiagnosed because many women are told their symptoms are simply stress or aging. Hallmark symptoms include severely dry mouth, dry eyes that burn or feel gritty, chronic fatigue, and joint pain. If you have persistent dry mouth alongside dry eyes and unexplained fatigue, please advocate for yourself and ask your doctor about testing for Sjogren's syndrome, including the SSA and SSB antibody tests. This one sounds simple, but it is far more nuanced than people realize. Chronic mild dehydration is extraordinarily common in adults, particularly postmenopausal women and older adults, because the thirst sensation weakens with age and hormonal changes. People who drink coffee or alcohol regularly without adequate water compensation are also at risk. Beyond water intake, deficiencies in key nutrients, particularly vitamin A, iron, and zinc, can directly impair the function of salivary glands. Vitamin A is critical for maintaining the health of mucosal membranes everywhere in the body, including the mouth. An iron deficiency doesn't just cause anemia, it causes a condition called angular cheilitis, where the corners of the mouth crack and become inflamed, often alongside dry, burning mouth sensations. If your diet is restricted, if you've had bariatric surgery, or if you've been told you're anemic, please have a comprehensive nutritional panel done. I want to spend a moment talking about why I'm so emphatic about this symptom, because some of you watching right now are probably thinking, it's just a dry mouth, surely it's not that serious. Here's what happens when chronic dry mouth goes unaddressed. Your oral microbiome, the community of bacteria in your mouth, completely shifts. With insufficient saliva, acid-producing harmful bacteria flourish. Cavities begin forming at an accelerated rate. Gum disease progresses. The gum tissue recedes. Teeth become sensitive, then painful, then at risk of being lost. But the consequences extend far beyond your teeth. The oral microbiome directly communicates with your gut microbiome. Pathogenic oral bacteria that are swallowed repeatedly have been linked in research to increased inflammation throughout the body. And emerging evidence connects poor oral health to cardiovascular disease, diabetes complications, cognitive decline, and adverse pregnancy outcomes. Your mouth is not separate from your body. It is the doorway to everything. And beyond the physical, the social and psychological impact of untreated dry mouth is significant. Difficulty swallowing food comfortably, altered taste, bad breath that doesn't respond to brushing, discomfort while speaking. These things profoundly affect quality of life. I see this in my patients. They begin to withdraw from social situations. Their confidence drops. And this is entirely preventable. I will not leave you without action steps. Here is my clinical guidance. Step 1. Hydrate strategically. Place a large glass of water beside your bed every single night and drink it before you get up. Throughout the day, sip water consistently rather than drinking large amounts infrequently. Aim for half your body weight in ounces of water daily as a starting baseline. Step 2. Examine your medications. Review every medication you take, prescription and over-the-counter, and check whether dry mouth is listed as a side effect. If it is, do not stop the medication, but bring it up with your doctor. There are often alternatives or adjunct treatments available. Step 3. Assess your sleep. Ask yourself honestly, do you wake up exhausted even after sleeping enough hours? Do you snore? Does your partner say you stop breathing? If yes, please pursue a sleep evaluation. This could be life-changing for you. Step 4. Get your blood work done. At minimum, ask for a fasting blood glucose, HbA1c, a complete blood count to check for anemia, and a vitamin D and B12 level. If your dry mouth is accompanied by dry eyes and fatigue, request the Sjogren's antibody panel. Step 5. Address the oral environment directly. Use a dry mouth-specific toothpaste. Products containing xylitol and fluoride are ideal. Avoid mouthwashes containing alcohol, which worsen dryness significantly. Consider a humidifier in your bedroom to add moisture to the air. There are also prescription-strength salivary stimulants and saliva substitutes that can make a substantial difference in severe cases. Step 6. Cut back on dehydrating habits at night. Alcohol and caffeine are diuretics. If you're having alcohol in the evenings or a cup of tea before bed, these are worsening your overnight dehydration. I'm not saying eliminate them forever. I'm saying be aware of the timing and compensate with water. I want to close with this. You know your body better than anyone. And when your body sends you a signal, every single morning, consistently, reliably, it deserves to be taken seriously, not dismissed, not managed with a sip of water and forgotten. Waking up with a dry mouth can be something simple and easily corrected, but it can also be your body's earliest, quietest way of telling you that something deeper needs attention. Your blood sugar, your immune system, your airway, your hydration, your nutrition. You deserve to know what it means, and now you do. I'm Dr. Naomi Chapelton. If this video gave you value, please share it with someone you love, because this information could matter enormously to someone who hasn't heard it yet. And if you have questions or want to share your experience, leave a comment below. I read every single one. Take care of yourself. You are worth that effort.